going in 2009. There's a lot of fear out there. There's a lot of concern. There's a pretty solid majority, better than Clinton had. We never saw anywhere near 60 votes for the Clinton plan. You can at least see 60 votes for what Obama's talking about. So I think looking from that point of view, what gives us the opportunity to think we can do something big? It may be there are one of those generational points that we can do it and just pull it off. Thank you very much.
Thank you very much, Walter. We have actually, what we're going to do is we have about 15, 20 minutes for questions. And so if we could have Rick and Walter come up. And at 2:30, we're going to start our presentation of the state budget. So do any of you, again, I want to thank both of you for being here. I'm very proud that we were able to entice you to come over. I don't know that you've ever presented together. Rick, do you have anything you want to say about what Walter has just presented in terms of some kind of reaction?
Well, I think Walter laid out a pretty skeptical and I'd say somewhat depressing scenario of what lies ahead. And I think he's largely right in describing that as the high risk. On the other hand, I think there could also be a great deal of pressure on the Congress when members go home for recess in August. If President Obama, if MoveOn.org, if other groups that are organizing health access, and all the groups represented in this room, are doing their job and really bringing and delivering constituency messages directly to members of Congress, that this is really important and they better get it done, and here are the things that we think are really important. I think we have a very good shot. And I think we do have, unlike 16 years ago with President Clinton, I think here we have a president who really understands the importance of mobilizing the population and the skills to do it, and an organizational structure that his campaign created to help do that mobilization. And I think that will be one of the greatest assets that he has going forward.
I think that's absolutely right, that the next 2 or 3 months are, I don't think we've seen a period in recent American history where a huge issue is right on the table and can be taken and pushed over. And how people respond to the next period. And it is, Obama's not going to get this by August, I don't think. And it is going back, people are going to go back into their research, district, and what they hear is going to be very, very important. And if they hear, I'm worried, I don't want this, or if they hear, you have to do this, bite the bullet, we want you to do this. Two very different messages here, real different. So I'm really hopeful. This is the time, we've got an organization to mobilize and get out there. This is the moment.
Do I see any questions? Yes.
I'm a nurse. I work at USC, and one of the big issues that we have is obviously undocumented people. I was at a community meeting yesterday, and there I was told that none of the plans that are on the table in any of these 5 subcommittees include undocumented people, which is a huge concern for us. So one, is that true to your knowledge? And when it says undocumented people are left out, meaning undocumented people won't be eligible for the subsidies, what does that actually mean?
Well, the information you have is absolutely correct. None of the bills would provide subsidized coverage to the undocumented. What the bills do is they're silent coverage, which means that the undocumented would be likely to get coverage very much in the way they do today. Rather surprisingly, not all the undocumented are uninsured. In fact, about 20% of them, or a little more, maybe a quarter, get coverage through an employer. They may not be doing it quite legitimately, but they're getting coverage, and they perceive that coverage. Some are getting coverage through our Medicaid program in California. As you know, we cover prenatal care. pregnant women, regardless of their status. So I think these are the kinds of efforts that would continue, and so there would be some coverage for the undocumented in that. In addition, all of the bills provide additional funding for the safety net to take care of people who fall through the cracks and who are most disadvantaged, despite the expansion of coverage that's expected. So I think there would be some resources that would flow, but politically, it's a non-starter to try to cover the undocumented, and they are not.
Richard Ellison, back.
Yeah, either for Rick, Rick, in terms of the payments, in order how to pay for the reform, you mentioned Medicare. As you know, residency training for doctors who goes through GME through hospitals uses the Medicare pass-throughs. If that's lowered, has anyone spoken about how that training would continue and what would that do to dish proportionate share of hospitals in your own community?
I really don't know the answer to that. I do know that Medicare fees are obviously a focal point for a lot of conflict at this literal moment in time right now in Congress. With the House bill proposing to increase Medicare fees, and then the Blue Dog Democrats in the House and extracting concession that would turn over the setting of Medicare fees for physicians and for hospitals to an independent commission, removing it to a considerable extent from the political process in the Congress. That's created a firestorm of opposition from the American Hospital Association and others. There is a lot of concern about graduate medical financial support. The bills do include additional funding for training of physicians and nurses and other health professionals, and especially to increase the incentives for those going into primary care. So I don't know the answer to that. I think it's a mixed set of policies that are probably embedded in
That's a good example of one of those kinds of issues that if you can narrow a response to, fine, but it could very easily spill over. And I remember in the Clinton plan, we had all kinds of stuff in here about academic medical centers and whatnot, and some liked it, some didn't. And the more people you bring in, the more opposition you bring in. I'd rather have it neutral than bring in opposition. If you're going to bring in opposition and support, I'd rather not do it. You're not going to get more support than opposition. It's there. And that's the kind of thing. It's how many doctors we have, where they are, how we incentivize them to go different places. Another day.
Dana, did you have a
I wanted to
question?
just add
Oh,
one
sure.
thing, but I think it's a good example of what Wally was talking about. Because on the one hand, if you provide adequate support and increase the funding for physician training through Medicare fees, you increase the cost of the whole plan. And then you are raising further the total cost of creating these reforms. That's become a major point of attack for Republicans and for Blue Dog Democrats who are threatening to vote in the Democratic majority and vote against the House bill. So they have some leverage there, and they've been exercising that leverage on this Medicare fee issue by moving it out of the political process and trying to lower the cost of the Medicare reforms in